Hello, this is Kyusha Kim from Seoul, Korea. I'd like to present a chronic disease affect lower urinary tract symptoms result from the Korean Community Health Survey. This is nothing to disclose. The risk factors of LUTS, other than aging, modifiable factors such as increasing prostate volume, obesity, diet, hormonal imbalance, metabolic syndrome, and smoking also contribute to the development of BPH or LUTS. So we like to add other specific evidence through this research. And lower urinary tract symptoms occur 20 to 50% people and decrease quality of life. Clinical observations indicate that many chronic diseases seem to be associated with LUTS. So we evaluated some of the factors in Korean men. When we see the study design, this study was raw data from Korean Community Health Survey performed by KCDC from August to November 2011. This survey targets South Koreans older than 19 years of age and was performed based on one-on-one direct interviews using computer-assisted personal interviewing. This survey was done it started from 2008. We calculated over 40 years of age South Korean man. It was 73,643, and we excluded 1,002, which is question items were not completed, and 8,006 were incomplete and complete of doctor diagnosed BPH and current treatment status, and 196 were in complete status of BPH treatment, and leaving a final sample was 64,439 respondents. We conducted with using questionnaires. Trained interviewers perform face-to-face surveys using computer-assisted personal interviewing, the International Prostate Symptom Scores, and standard questions. Social demographic characters are shown right here, and 64,439 people were enrolled. And here's a number of the groups that overaged 40 men, and there's a chronic disease that we analyzed. So we observed higher IPSS score in participants who engaged in hypertension than in those who was negative to hypertension. And other chronic diseases showed higher IPSS score compared to non-holders. When we compare the storage symptoms and voiding symptoms, DM patients showed higher storage and voiding symptom scores compared to non-DM patients. In dyslipidemia patients with non-dyslipidemia patients, it showed higher storage symptom scores who have storage symptoms compared to dyslipidemia holders. Other chronic diseases showed higher storage and voiding symptom scores in group of presenting storage and voiding symptoms. In multivariable logistic regression analysis, we detected no relationship between LUTS and chronic disease. Most of chronic disease were related with LUTS and severity. Depression showed the most highest old ratio. However, osteoporosis showed irrelevant figure. Most of chronic disease have related with storage and voiding symptoms also. Arthritis and glaucoma showed relationship with storage symptoms. And the participant with depression presented strong relationship with voiding symptoms. So, interpretation of results, most of chronic disease had relationship with LUTS. Arthritis, strokes, depressions were associated with a greater severity of LUTS. Arthritis and glaucoma were also related to storage symptoms. Also, depression presented a strong relationship with voiding symptoms. Chronic disease need to be considered in clinics with LUTS, and further studies are shown to be should be necessary. Thank you very much. We hope to see you soon. Bye bye.